In this video, we are going to highlight some areas where you can improve your linguistic tendencies and how to work around them. Consultations for Health, helping you progress in communication skills to optimise the care of your patients. We all know that what we say and the way we say it can be critical when working in healthcare. The way we talk about someone's health can change the patient's entire outlook on a situation. The public may have little knowledge about complex medicine or anything else related to healthcare because they do not need to until it affects them directly. To get started, we're going to talk about a pitfall that many professionals fall into, which is the use of inappropriate language. Now, we do not mean that professionals are using too much slang or offensive language. We are talking about professionals using patient-inappropriate language. Using patient-appropriate language is one of the most important tools we have during a consultation because it can help educate our patients and empower them to make the right choice for them and their loved ones. The aim of using patient-appropriate language can be thought of as describing a health topic in an easy and digestible way so that people involved can easily comprehend the discussion at hand. Now let us talk about some practical tips for using patient-appropriate language. Avoid jargon without an explanation. Jargon can be described as using special words or expressions used by a group that are difficult for others to understand. As you may be aware, most healthcare terminology falls under jargon to the public, making it more difficult to talk to patients about their health in a way they could fully understand. Using technical, complex, or terminology that is poorly understood by most can easily make the patient feel dumb or disconnected from the conversation. This is obviously bad, as the trust and rapport built up through a conversation can easily be lost when a patient cannot feel part of that discussion. Mixing the world of healthcare terminology and normal life language for a patient can be tricky, and as healthcare professionals we cannot always avoid jargon. We may need to give our patients all the information they need to make informed choices about the next steps in their care. Therefore, we cannot ignore the facts, even if it is going to be interpreted as jargon. It is crucial that we explain any jargon that we use in a way that the patient can understand. One way to think about avoiding jargon is to try and use layman's terms. This phrase means to explain something simply and to use easy, comprehensible words that the patient will understand. Using the same common words and vocabulary and avoiding jargon can help to maintain and build rapport and trust with the patient. It shows you can empathise with their situations and view them beyond the medical world. Our next tip involves thinking about your patient's perspective, pitching your discussion at the right level based on their understanding. This means knowing whether we can use some jargon our patients will understand, or whether that we need to use mostly layman's terms for them to follow the conversation. It is useful to note that a patient's health status can influence how much they can understand about their condition already. Chronically ill or patients with conditions that may flare up and recover can often become experts in their own healthcare or the care of those they look after. It is likely that these types of patients may appreciate more technical or concise information. On the other hand, a patient with an acute condition or a new diagnosis may not understand any technical jargon, and they will therefore require easy, digestible information about their healthcare. As you can see, it is important that we pitch our consultations at the right level based on our patient's requirements. We should remove information that is excess and not required, but make sure that the information we are providing is fully understood by our patient. If you are unsure what level of detail your patient could appreciate, you should try asking about their experience with their healthcare. Are they typically healthy? Is this their first time experiencing these symptoms? Have they had this type of procedure or test before? Some patients will show that they understand by adding more information on top of what you have said. Whilst, if they do not understand, they may ask a question or just wait for a further explanation. We have already talked about what to say, but now we need to talk about how we say it. Thinking about our patient's perspective again, we do not want to just start unloading information continuously. Keeping a regular rhythm and pace to the conversation can help prevent overwhelming your patients. Speaking in an appropriate tone can also calm the patient in challenging situations. Remember, our retention time is a lot shorter when we're stressed, and patients may not be able to handle a lot of information all at once. To avoid blurting our information, we can use a tool we have talked about before: chunking and checking. In this context, this tool relies on giving a small chunk of information and then checking the patient has understood by getting them to do something active, for example, repeating the information back to you. This method can allow a patient to process those smaller chunks of information and follow along with the conversation more easily. We have already made a video talking about chunking and checking, so feel free to check it out for more information and examples. In addition to everything we have mentioned, we need to make sure the patient understands what we have talked to them about. Sometimes we can visually see that a patient is struggling to understand what we've described to them. Other times, a patient can verbally let us know that they are not following along. In situations like these, it's important to consider why the patient may be struggling to understand. Are you using jargon? Are you speaking too fast? Have they understood the context? It's important to remember to reassure the patient that it's okay to not understand something and allow them time and space to ask questions. If you can figure out what's causing the confusion, try your best to re-explain something. You could consider using a metaphor or a comparison to help explain. Patients may remember a metaphor more easily than technical medical jargon. However, it is important to explain the fundamentals so they can be informed about their health. Physical models can make something easier to understand, as well as provide a visual reminder of the conversation when thinking about it later. This is useful when talking to the patient about something they may be unable to visualise very easily. For example, internal organs like the uterus or intestines. It's key to remember that we want to make their health easier to understand, not dumb it down. Sometimes you will be unable to fully explain something to the patient in the short amount of time you have. Or perhaps when a patient may need more time to process a diagnosis before you can plan the next steps in their care. For example, a chronic diagnosis like rheumatoid arthritis or a cancer diagnosis. In these situations, we can direct patients to other resources like leaflets or websites. This is called signposting, and it allows the patient to take control of their health literacy and acquire a more in-depth understanding of their health as they require. This can be when your explanation is more surface level, or when you know that a topic is particularly difficult to understand and process. We hope you've enjoyed this video, and we want to thank you for your continued support. Make sure to like, comment and subscribe to see our future videos. Check out our socials linked in the description below for quick tips.